Okay, I would like to welcome everyone to the Board of Health meeting. I think today's the 27th. So this is our first Zoom meeting, so please be patient with us. And we're just going to treat it like a regular physical meeting. We're going to ask that all comments be directed through me, the chair. And if there are people who are interfering with the actions of the board, they should be warned, and then they can be removed if they continue to interfere. You'll get one warning and then you'll be removed. In Zoom, it is easier because to remove someone from the meeting, the chair would just need to direct the host to remove someone from the meeting. Okay, so now people that join the meeting are set so their microphones are muted so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. Should any member of the public wish to speak, we ask that they use the chat box to let staff know they would like to be recognized. Staff will monitor the chat box and inform the chair of individuals that you wish to speak. Upon speaking, we request the microphone be placed back on mute. We appreciate everyone's patience as we are all using new technology to conduct the business of the board and the town. Thank you, and let's begin. So, Janet, there were a couple of things that couple of items of business that we're going to take care of.
Louise, if you want to just sort of give a quick rundown of the numbers that will be the numbered items that we're just going to go through during the meeting. That way people will understand when they can have a chance to speak. Did you want me to do that?
Is the order of things? Is that what you're talking about?
Yes.
Okay. Okay.
We're fine. Breathe.
Yeah, right. So first of all, we will have a motion by Lisa Flanagan to appoint David Sabula. I apologize if I said your name wrong, David, of 233 Foster Street to the Littleton Volunteer Corps. We will take a second and then roll call. So should we just stop and do that right now?
If you'd like. Go ahead, Lisa.
We might as well.
I'm just going to just make a motion before the board to accept David Sabula as a member of the Littleton Volunteer Group, the Corps. So I'm looking for a second.
Second.
Okay, so
So we have to take a roll call.
Correct. So Lisa, can
Aye.
you vote?
Yes.
Mike?
Aye.
Aye.
Kevin?
Aye.
Okay. And Gino is not on yet, correct? Or?
I set up the phone number. Was it the 646 number the best one to call? I don't know.
Okay.
The best one to call.
I will say aye for myself as a vote.
Okay.
Next item. We'll have a motion by Lisa Flanagan to grant permission to Jim Gareffi to sign septic permits not requiring a variance. We will take a second and then roll call, just like we just did. So Lisa?
I'll second that motion.
I have to make the motion first, Mike. So I make a motion to allow Jim to sign septic permits that contain no variances while we're on this temporary, I don't know what you want to call it, furlough.
I'll second it.
Okay, now we'll take the roll call. So Lisa?
Aye.
Mike?
Aye.
Kevin?
Aye.
And myself am aye. Are you all set with that, Janet?
All set.
Okay, so Kevin, I know you have a lot of questions that you would like to talk about. So we're going to give you 3 minutes and you can voice your concerns. If you want to go ahead.
Thank you very much. Just wanted to start off and say that I'm super grateful that we have Mr. McCurdy and Chief Wazinski on board, and they are on the front lines of what is about to hit us, I think, in probably about 3 weeks. Mike, I don't know if you have an exact timeline of what you feel, but we can definitely get into that. I think that we should probably take some precautions. I don't think there's anything wrong with taking an overabundance of caution at this point, to try and develop a large group of residential volunteers that can help, that have skills and really smart folks, and try and set up what will be sort of looking into the future and seeing what it's going to be like in 3 weeks based on how this disease has traveled in other parts of the world, and get whatever materials we can, think outside of the box, and get some things set up so that we are prepared when this hits in 3 weeks. And I know there's a lack of supplies. We can get creative, and I have some thoughts on that if you want to get into it. But I just want to know what's the board's thought on, how much worse are we going to let this get before we get into lockdown mode and have people sort of, shelter in place. I think we should have a system set up with, Littleton town vehicles and arrangements with Donnellan's and Market Basket to become more like warehouses of food, fully sanitized, and then have the town provide services to get the supplies to the people at their homes. And I mean, there's a lot of planning that has to be done. We need to reach out to the citizens that work for medical supply companies or Biogen or whoever it might be, and try and leverage those relationships somehow to try and get some support, because I don't think we're going to get it in a timely fashion from the state, and we're not going to get it from the feds. And I think we have to act now before it's too late. Do I have more time? I think we should redefine essential people, doctors, emergency people, pharmacists, activate all of our relationships and all work together, because I think it's going to be really, really bad in 3 or 4 weeks. And we don't have any cases now, but I don't know if we actually have any. How many tests do we have, and how many people have been tested? I mean, I don't want to end up like the situation in New Jersey where the test came in, there were 2,300 tests and 1,900 people tested positive. I think it's spreading rapidly. A lot of people have it, they don't know it, and it's a big, big problem. And I'm really scared.
Is that everything, Kevin?
Let's see, Mr. McCurdy. We should get the Corey checks out to people who need to be Corey'd before they can join the Littleton Volunteer Corps. We need a strong recruitment plan. Cindy Napoli, I know, is excellent on Facebook. Maybe we can reach out to the selectmen and select persons and see if they can get really creative with the social and just put it out to everybody that, we are going to do something and not let anybody determine our future here except us. I don't think it's a wait and see thing. And, why should we let events that happen elsewhere in the world happen here when we know we can do something about it?
Okay. You're not alone, Kevin. There are a lot of people very scared. So I think this is a very timely meeting, and I'm glad we're here with this technology to discuss issues. So now I'm going to pass the meeting.
I would like to say that if we could please schedule another meeting before the end of this meeting, so we can just get it on the books and keep the conversation going.
Yeah, we'll have to keep it rolling. So now I would like to pass it on to Scott Wazinski, the fire chief, please.
Make sure the mic's on here. Good afternoon. So obviously this is a time where, none of us have ever been here before, across the entire world. So this isn't a Littleton thing or, a Massachusetts thing. It's a worldwide event. And we are doing everything in our powers to look at this and control this and try to, controlled chaos is pretty much what it is. The biggest thing is to try and keep people calm amongst our own communities and, heed what the governor is saying. We're in a state of emergency. Keep your social distance. You're 6 feet apart. You don't need to run to the store and empty everything off the shelves. Take what you need right now and act accordingly. You can go outside and get some fresh air and be in the sun. We're not talking about putting our children all at a neighborhood birthday party so that they can all hang out because they're off of school. Social distancing, wash your hands, take some of these normal, safe precautions. This is going to get worse. We have finally seen an uptick in the testing. I'm sure Jim Gareffi can expand on this a little bit more. As the testing comes forward and we finally get that through these other facilities, we're seeing the numbers climb, and that's anticipated. We're seeing younger generations that are carriers. They have no signs or symptoms at all, and yet they're bringing it to the older generations, and that's where people are getting sick. Yes, this has been around for a few weeks, but one of the biggest things that we need to remember is, it started in China. It started, in other parts of the world, and supplies were sent there initially because they needed them. And now we have these issues, in our part of the world, and we are worldwide all competing for the same supplies. So there's no magic pot where we can just say, hey, you know what, I have an in, or my buddy works for this company. We'll call him up and get the supplies. It's just not a thing. So the government has actually stepped in, and they have taken, all of these orders, these large orders are coming from these companies into MEMA, into DPH. There are central request sites on DPH and through MEMA where we are putting in our requests for supplies, for materials needed, masks, gowns, gloves, thermometers, all of that stuff. And it's put on a priority list for those towns that have several hundred or several thousands. They're obviously later on the list, where, some of the other towns have very limited supplies. So the government, National Guard, has actually been out. They're making deliveries to these towns that are in a critical need, delivering supplies so that, we can be kept up to speed as we come into more and more patients with the flu-like symptoms. And there are two different things as far as, right now they say there are not any diagnosed, or should I say, any patients in town that are confirmed, like through the Maven system, at least not that I'm aware of as of today. So those are actually patients that are getting swabbed and logged into the system, and they would, excuse me one second, and they're being told by the Board of Health that you have these people in your town. The other way is by simply going to your primary care physician, who might say, yes, you meet all the characteristics, you have all of the symptoms, go home, stay quarantined for 14 days, and that never gets logged, and you don't know about it. So you can only hope that these people heed the warning and stay home, and for everybody else's benefit. It's a matter of people using common sense, and that's a very difficult thing in situations like this, because people have nothing better to do because they're home and you're not in a normal work routine, and so we all kind of get into a state of panic, especially when people don't know what's going on, and that can be a challenge. So I applaud everyone's effort here. This is a team effort, with fire, police, Board of Health, the volunteer corps. We are all going into this together, and there are certain things that we can do. We can prepare. We can have equipment that will benefit us as we respond as emergency responders. We've had discussions about potential testing sites, and as we look more into that, that's something that we really aren't even capable of being equipped to do. We don't have refrigeration facilities, significant supplies, testing resources. It gets so in depth with doctors' approvals, all of this stuff. It's quite a process. And for that to happen, right now, we're really going to rely on the medical facilities to handle that and really direct people to those facilities as they increase their testing procedures. They have the trained staff to do it, the refrigeration techniques, the full chain of testing procedures as it gets passed on to the labs. They have all of that, and we're going to rely on that because, unfortunately, as a community, that's really out of our league. If it were to come to a dispensing site, like if, hey, they now have a cure for this and everybody needs a shot, we could do something like that through the Neshoba Board of Health in conjunction with them. We would be support for them, but we wouldn't necessarily, say, hey, yep, we can take care of this. So it's kind of a group effort. I mean, I know I just kind of covered a lot of things there, and but just in general, that's kind of where we are right now.
Okay. Thank you very much, Scott. Does anyone have any questions for Scott before we move on? Okay. Oh, Kevin, did you have a question?
Yeah, I'm just wondering, would it be helpful for you, Scott, if we try and coordinate some, logistical management and oversight to get some sort of operation, like a boots on the ground operation going with, different volunteers and people trying to source things and just having a little, foresight and just doing some probably hopefully over cautious planning. But, it might just be, helpful to get somebody to take a load off some of the planning and logistics and management of the locally stuff. I mean, what do you think about that?
Well, right now, as far as our individuals like our volunteer corps, if something were to come forward, we would really rely on them as being our support. It's a vetted organization that's had training. They've gone through many different things, and we rely on them as that support. Currently, the emergency services through fire, police, if things were to evolve, we'd really, amongst our staff and our part-time members and other resources, would really rely on that within our own facilities. It's not. This is a different type of a situation. If we were to say have a tornado or a hurricane or something like that, where it's really practical to have boots on the street, checking on your neighbors and assisting neighborhoods, things like that. That would really be, that's a different ballgame, and we would really reach out of our comfort zone and ask for assistance in any way that people could help. But I think right now, if we can stay organized, continue with our stuff, please, by all means, check your neighbors, check your friends, check the elderly. Some of those folks may need some stuff picked up at the pharmacy or the grocery store. That's probably the best way that people could reach out and really offer assistance right now.
Okay, great. Thank you so much, Scott, for joining the meeting. And now we're going to ask Jim Karefi to give us an update and address some questions.
Thank you, Louise. I just want to start by kind of piggybacking on some of what Scott said. Since this has started, our public health nurses have been doing the disease surveillance and monitoring that's required at the state by boards of health through the MAVEN system. So as Scott mentioned, if there is a lab confirmed case of COVID, it comes through the MAVEN system. A public health nurse then will contact the individual who's tested positive. We'll provide some education and review the isolation procedures with them as the state requires. they also set up an ongoing monitoring system. Part of that process is the nurse will then identify with the person who tested positive those people who had close contact with them. And close contact for this purpose is somebody who is within 6 feet of somebody for at least 15 minutes. Though that list of people will then be contacted by the public health nurses, and they will be asked to quarantine for a period of 14 days. They'll be asked to provide ongoing monitoring to us. And the nurse will check in from time to time to make sure they're not developing symptoms. What's important to note is people throw these terms isolating and quarantining around. In public health parlance, if you're being asked by a public health nurse to isolate, that's because you're sick. And there's in this case, a lab confirmed case. And you're being asked to stay in your house under strict isolation until you're released by the public health nurses. And what they'll do is they'll monitor the case, and over the period of time when they believe, and there's a set series of conditions under which somebody can release, they will release the person. The people under quarantine, again, quarantine is for those people who may have been exposed but aren't currently sick. And the reason we quarantine them is we want to try to limit any potential exposure if they were happen to become sick from the illness. So that's why we ask them to quarantine. And if at the end of that quarantine period, no symptoms have occurred, then the nurse can release them from quarantine. So we're currently doing that now. Brought on a couple of additional nurses because we're getting more and more cases in there, and that contact tracing component of it becomes really difficult, lots and lots of people. We've also brought on a person to help us with hopefully some social service kind of issues that people may have if they become quarantined. So we're doing that. We met with someone this morning to hopefully be able to do that. As far as the social distancing, I think it's really important that people be given the opportunity to adhere to that. And as I drive around town, I'm not seeing large gatherings. As we look around, we kind of are checking to see the restaurants, see if people are queuing up, see if people are not paying attention, sitting in places, and we're not seeing a lot of it. So this is all anecdotal, but it appears that people are getting that message. Now, I don't know what they're doing in their backyards. I don't know what they're doing in their houses, but hopefully we can keep reinforcing that message of social distancing so that we can keep everybody safe. Scott mentioned the emergency dispensing plan. That was a plan that was put together with the Board of Health and the fire department. And we have used that plan for not only our seasonal flu clinics from time to time, but during the H1N1 little bit of an issue, I don't want to say crisis, but when we had that issue, we actually used that plan to vaccinate kids in all the towns in the district. So that plan's there, may be adjusted if at some point in time there's a cure or a vaccine for coronavirus. So we can certainly take a look at that as part of our planning to make sure that's as up to date as it possibly can be. So if we're called upon to do that, we can actually do it. The other part is, I just got a call today about people filing complaints about facilities they don't believe are following proper procedures. So we are following up on those complaints. If somebody doesn't think they're either staying far enough away from people or somebody's coughing and hacking in a business, we're getting those calls, not a lot of them, but we're getting them. And our role is to go out and kind of educate the facility. We can't really prove that they're happening, but go out and educate the facility that, hey, we're in this situation where you need to really be paying attention to the social distancing, to making sure people are staying at home if they're sick, to washing your hands, to the proper cough and sneezing etiquette, so that we can reinforce that message. I don't know if you have any other questions.
I have a question for you, Jim. Can you update us on the number of cases in Littleton, if any, and surrounding towns that you are familiar with?
So as of this morning, I talked to Tamara, there were no cases reported for Littleton. I think we have about 13 or 14 cases throughout the district.
Okay. Does any other member have questions for Jim?
Can you hear me?
Yep.
I think I know with my work, the Mass Dental and American Dental recommended stopping seeing patients unless it was emergencies. There's a difference between recommending and requiring, I would assume, right? So we have like non-essential, but Kimball's is opening. Like, is Kimball's really essential? Are restaurants really essential in this time? We all have food, we can cook.
So I guess that's kind of a balance and anecdotal based on the dental experience. I got a call from my dentist this morning canceling my cleaning appointment. And I ran into a dentist doing an inspection at his house for a septic system. And he says he's only going in for emergency procedures. So that message is being received by the dentists out there. And so I think they're taking that to heart. I think anyone who works in somebody's mouth is probably increasingly aware of the fact that that's probably not a good thing to do unless you absolutely have to. To the restaurant part of it, I guess you're trying to balance their ability to do the proper social distancing with people's minimal desire maybe to get out, have a change of scenery, get a
And
meal
an
out.
economic.
Yeah, and certainly the economic. And sometimes, you know, if you weren't the first person who went and took all the food out of the supermarket, maybe this is serving as a way to supplement what food you have in your house. So I think it serves an important role. I've seen restaurants where they've painted or taped little squares on the floor so people know to keep that distancing. And that's something that we'll be doing as we get complaints and as we drive all our health agents, as we drive around our different towns, just to make sure that, you know, people are observing that social distancing component.
I mean, it is part of the governor's order that restaurants are able to stay open with takeout only, correct?
Correct.
Mhm. Okay.
There is guidance there. There's also guidance up on the Department of Public Health's website about how the Board of Health should approach things like inspections and making sure they're doing social distancing and advising on disinfectants so that the restaurants can stay safe.
Mhm. Any other questions for Jim? Kevin?
Jim, do you feel like it's in the best interest of public health right now to start to talk about CMR section 300.210 procedures for isolation and quarantine?
So our nurses do that when they get the positive cases and when they do the follow-up cases.
Mhm.
And so the notices that I'm putting together that kind of let towns can use to put on their website to let them know about positive cases has language in there that's talking about isolation, kind of that a brief description of what I said to you about if you're testing positive, this is what's going to happen. It's called isolation.
Yeah,
Close contact, this is what's going to happen. It's called quarantine.
I was actually referring to the section I about the isolation and quarantine of people in a geographical area.
At this point, I don't think we're anywhere near having to have that conversation.
And at what
That would be mine.
at what level do we have that conversation?
I don't know. I guess I would be having a conversation with the Department of Public Health, their Office of Epidemiology, to make that determination.
But this board could make that determination on a local level.
I don't know. That's something I'd have to check and let you know about.
Would you let us know?
Yep.
Thank you.
Louise?
Yes, Mike?
It's Mike. Can I just make certain comments directed toward Jim and Scott?
Sure, go ahead.
I want to thank them both, and I hope they keep safe and get lots of rest. This is a tough thing to do. I appreciate it. This may date me, but my only experience with anything that comes close to this was the Cuban Missile Crisis. So that makes me an ancient warrior. To me, this is a fraction of the threat, but that's just my narrow perception. What I've noticed more than anything, and here I get more phone calls about, and so my question is to both of you, if you have any ideas, are mainly what I would call emotional or psychological. And I was wondering if if it's worthwhile at all to consider, even though it may not be sufficient, enlisting the aids of counselors and other mediators who have certain skills, who are employed or professionally licensed in town, to see if they would volunteer their services using technology for those families, especially those who have kids all at home at the same time, to basically have brief voluntary, I'll call it counseling sessions, to at least take away some of the pressure. I don't know how practical it is. I've only seen it in action, as I said, under one circumstance, and that may not count.
Scott, I'll jump in. I wouldn't know where to begin with that, but certainly a consideration. I'd have to admit, maybe I'd start with talking with a public health nurse to see even how to begin kind of that. I'm not sure how you would set it up. I guess it'd have to be Zoom meetings, there'd be phone calls, I don't, there's a whole bunch of pieces that, to try to figure out how you might go about that. But I can certainly touch base with our public health nurse to see what she thinks. The person that we brought on to help us with the social service part of it, some of that is kind of maybe not directed to your question, but kind of around your question. When they had the SARS issue up in Toronto, one of the ways they were successfully able to keep people quarantining in their houses was to be able to provide them services. And so that's what we want to be able to try to do, is to see what people need, try to help them find it within their own family and friends. And then as a last resort, whether it's Council on Aging or food pantries, try to help them figure out how we can support them in their homes.
Thank you. Thanks very much.
Mike, are you looking at the chat right now? Are you
Janet is monitoring that.
Oh, okay. There's somebody made a recommendation.
Okay. I just wanted to say to Jim, would it be possible, I'm not even sure, but if we set up a time on Zoom, like we would set up a meeting ahead of time and people could call in, if we had one of your mental health professionals have a Zoom slot for people to call in.
So we
And
don't,
maybe,
we don't have mental health professionals. So I guess I'd be real careful about doing something like that. I mean, you obviously would want to have somebody who's credentialed. That's why, to Mike's question, I'm not really sure how you would do something like that. I know the state has on the state's the Department of Public Health's website on the Corona page, they do have some resources for people who may be feeling distressed. But I mean, we can certainly think about what something like that might look like. I'm not sure you really want to get into the business of doing behavioral kinds of counseling. I don't know. I haven't heard any other Board of Health and all of the conference calls I've sat in do something to this effect.
I guess it would violate HIPAA laws also.
Well, it could.
Privacy.
Yeah.
Louise, somebody
Yes.
did write in on the chat. Judy R. said that physicians are using doxy.me, including mental health clinicians. That's all that it's written. So I'm not sure if Jim's familiar with that or if it's something that is really just with physicians and mental health workers, but that was the comment.
Okay. Could you repeat the website, Janet? I couldn't, it wasn't clear.
Yes, it's called Doxy, DOXY.me, M-E.
Okay, so maybe people can check that out.
I can certainly take a look at it and ask other public health officials if they're using something like that.
Thank you, Jim.
Yep.
Okay, are there any other questions for Jim? Okay, it looks like we can, thank you, Jim, for your help today and
Sure.
showing up. And also now we can go to Alex McCurdy with the Director of Littleton Volunteer Corps.
Hello, everyone. Thank you for doing this today. I would like to say a couple of things. The Corps, since in its current organization, has been working since 2015 for the unknown. Well, the unknown is here. And we're as ready as we can be in an environment that nobody's ever been in before. What I will say is that the leadership we have in this town is doing a really good job at going with what needs to be done right now. We're not one of the places that is in trouble. I believe that our governor and our health departments have done a pretty good job of trying to get ahead of the curve here. And I think that shows in the numbers that we have of cases. It's not a matter of where the horse gets out the gate, it's how fast it runs at this point. So as far as the idea that we should take more drastic measures, I think that we're in pretty good shape in an environment that we don't know what it will take us to, but we're in good shape. And I'm pretty confident that Jim and the chief are on top of absolutely everything. And when the need comes, they're certainly going to be the first to ask for it. They're great advocates for my core of volunteers and everything the public right now. Speaking to the mental aspects that people are trying to cope with in this environment, it's a disaster, and people behave differently in a disaster. They have a tough time and they have to struggle, and the single biggest thing they can do is talk to each other and be there for each other and spend time on these apps, going back and forth, and just try to have the frame of mind that, you know, one way or another, we have to get through this. And that'll be a big help. So other than that, I'm glad you appointed our member. When we get members, they go through the process of a Cory check and a willingness to participate in the training. The training takes years to get through a cycle of, to be put in a position to work like we do now. And I'm very confident in the organization and the people that are in it, that whatever the need comes, we'll be ready to assist whoever has that need. So thank you for having confidence in us.
Okay, thank you for coming on today, Alex. And I would appreciate if you would come to another meeting and we can go more in depth for the Littleton Volunteer Corps, because it would be very beneficial for everyone to hear exactly what is your responsibilities.
As Joe Knox will attest, careful what you ask for, you might get it.
Okay, so once again, I appreciate Jim Gareffi, Scott Wadzinski, and Alex McCurdy coming on to our meeting today and giving us updates and all of the knowledge that you answered to our questions. I appreciate it. Do any board members have any other questions?
I had a question, but I think you answered it, Louise, about Alex coming to one of our meetings and explaining exactly what the volunteer corps are going to do if there is an emergency, and how do you get on the volunteer corps too if you need other people, you know, with a different select talent or something like that, if you want to put that out to anybody too.
If you're expressing interest, you're on.
Well, maybe. I could put pressure on a wound or something like that.
You want to talk about that? Oh, sorry.
So just another meeting for Alex to come. Maybe after this is all done, but also maybe another while I have the floor. Just definitely schedule something with all three of these guys for a week from now, just to see what we're doing right, what we're doing wrong, what we need to know about. That's it.
Agreed. I would like to schedule another meeting for next week. And from my schedule, Wednesday would be good. I don't know, but for anybody else's, Wednesday may be the same time. Just
It works for me. Hi.
good for you, Kevin. Lisa, is that good for you? Janet, is that good for you?
That's fine with me. Whatever you folks decide. What time are you thinking?
Okay, 1 o'clock, same time. Mike, is that good for you?
Yes, I can move whatever I've got to this date. Fine.
Okay, Jim Gareffi, would you be able to make that?
I have a public health conference call at 1 o'clock. So other than that, if it were just a little bit later, I could do it. They usually last a half an hour.
So should we say 2 o'clock to be safe? Okay. Where did I leave off? Scott, would you be able to make it next week, Wednesday?
Yeah, next Wednesday at 2, I could do that.
Thank you. And Alex?
I should be able to make that work.
Okay, great. Okay, Janet, were there any public questions that we can answer before we sign off?
Just if you wanted, I don't see anything from the public on chat, but I know that we've got 25 participants, a lot of whom are not part of the board or are invited guests. So maybe somebody of that group has a comment or a question.
Okay, we can open up questions to those people while we have our guests here that have a lot of information to answer questions. So we'll give them a few minutes to log on or whatever they have to do.
Nope, they're on. It's just a matter of whether they have any questions. All right, I don't see any hands raised.
I see one. Christine Nordhaus has one.
Okay. Let's see.
I'm sorry.
You can go ahead and speak.
Oh, hi, thank you. Can you hear me?
Yes.
Sorry, my puppy just spilled my coffee cup all over my computer, so a little chaos here. I have a question actually for Alex, if I could, through the chair. I was just curious about how people do sign up to participate in the volunteer corps, and if he is looking for any specific skill sets.
It's a very simple process. The one absolute is you have to pass a Corey check through the town. The town
Okay.
administers it. Beyond that, any skill set there is or may not be, other than a willingness to volunteer, is fine. We have a lot of different things that we can do. We have some medical professionals, retired medical professionals. We have people that are computer people. We have people that are former first responders, such as myself and a couple others. And it's that mix that makes the organization work and makes it so versatile. So the answer is, if you want to volunteer and you got a little time to do it and you're willing to be trained, you've met the requirements.
Great. I will sign up. I have passed a Corey check, and just so you know, my superpower is logistical management and organizational stuff. So if you do need anything like that, I'll make sure that you have my information right away.
We'll get you an application.
Thank you so much. And I'm all set. You can mute me again.
Okay, do you see any other people, Janet, that would like to make a comment or question?
I'm sorry, I muted myself. Some of you are just a name and not a picture. So if you have a question, you can chat that in or hit unmute on your own. I'm not seeing anybody else, Louise. Looks like everyone else is good.
Okay, so let's wrap it up. Can someone make a motion to, first of all, I'll just repeat that our next meeting is Wednesday at 2:00. And we'll do the same Zoom fashion, obviously. And if someone would like to make a motion to adjourn.
I'll make the motion to adjourn, Chair.
A second?
I'll second.
Okay. So this meeting is adjourned. Thank you all for attending.
You're going to do a roll call, Louise?
Oh, right, sorry. Mike,
Yes.
Kevin,
Yes.
Kevin?
Yes.
Okay. Lisa?
Yes.
And I say aye also, yes. And hopefully next time we'll get Gino on.
Yes.
But
Thank
not
you.
not in the same room, because we have to socially distance.
Right. We'll get
He
him
can't
up and going.
He can't be over our shoulder.
No. All right, thank you everyone for attending.
Thanks.
Thanks.